Hi, I'm Robin Boyce for City Corner, and yes, we are in a pandemic, and we're about to find out more about how you can cope with COVID at this time, and also, can you still sign up for the census? Come on back. We're back in the studios, Zoom studios anyway, with the Congressman for the 1st District, Clay, and we also have on our Regional District Manager for the Census Bureau, who's going to here to talk with us about the census today. Let me get everybody's names correct. Ms. Marilyn Sanders, who is Regional Director of Chicago's Regional Census Center. Thank you so much. Thank you, Congressman Clay, for all coming on. I really appreciate it. Thank you, Ms. Sanders, for taking our time. One of the things that we're really concerned about along with this pandemic is the census and how important that is for our communities. Ms. Sanders, could you tell us, can we still fill out forms and can we still send them in?
Yes, in the midst of COVID-19, and again, thank you for allowing me to be here. Thank you, Congressman. But in the midst of COVID-19, we have the opportunity to still be counted. So you can be counted online, by phone, or if you have that questionnaire still sitting in your home, put it in the mail. But yes, until October the 31st, you have the opportunity to be counted.
So we do. We have some time to make sure that we fill out those census forms and make things happen properly. Then that's really good. Is filling out the form online something that is safe for people? Because that's a lot of what folks are scared about. That talk to me about filling out that census.
Yeah. So the census is safe and it's secure. It's so important for everyone to know that your answers will never be shared. We don't ask Social Security or any financial information. It's strictly the names of the person in the household, the sex, the race of those individuals, and the relationship, just to name the questions that are there. But the census is safe. And it's important that we take the opportunity now to respond to the census. You can still respond, and that's the message that needs to be so clearly communicated.
That really makes a difference. One thing that I found also listening to some constituency is that they're getting phone calls. Should the census be calling people?
Yes, there's a quality control. So as we have received responses online, there's a need to call back and to verify and to qualify. So for example, if you say that there's 5 people in the house, but you list 4 names, we're going to call back to see if you meant to say 4 or if it's actually 5 and did we miss an individual. So yes, there are quality control that's going on to confirm that information. It's important to note though, when you get that call, if you have any questions, you can call back 844-809-7717. So, and then you can go to 2020census.gov to validate that that is a legitimate call.
Okay, great. That's some good information. I appreciate that. Congressman Clay, you sit on the House Oversight Committee for the United States. As a congressman, you oversee what's happening with that census committee. There have been some things that have been going on from the White House, switching people in, switching people out. Are we safe? Can we know that everything is going to be good with the census this round?
Yeah, I would think so, because here's why. The people who work at the Census Bureau, like Ms. Sanders, are dedicated, committed government employees who have been doing this for years.
Yes.
And in 2010, I was the chair of a subcommittee that had the oversight over the 2010 census. Now I'm just on the full oversight committee. But we, and as you remember, at the beginning of 2019, the Trump administration tried to submit a citizenship question on the census, and we were able to win in court and get that thrown out because we knew it would dampen the response from certain populations, and we didn't want that. We want the most accurate picture we can get. Since 1790, every 10 years, this country has taken a census. And it is a snapshot of who we are, and we try to get the most close and accurate count as possible. Also, for your viewership, they need to know that for every person the census misses, then that's $1,500 less per year that would go into your community for, say, food for food pantries, or roads and bridges, or for schools. So, and over a 10-year period, that's $15,000 per person that they miss. And we are trying to also get people acclimated to actually counting prisoners in the communities where they come from.
So
or
prisoners
will be
are
sent
not
back to.
Prisoners don't do the census?
Well, right now, what happens with prisoners is they are counted in the communities where the prison is. But like the state of New York passed a law about 4 years ago that allows that data to be reported to the last census, or that inmate to be counted in the last census tract that they were in.
Okay, all right. So so we've got everybody who can get online or send in a form if they receive it in the mail. It can be a difficult time for a lot of people, and they're not thinking about doing the census. How can we start helping people to remember that they've got to fill out those forms and Sanders?
Well, let me say before Ms. Sanders answers, in April, when we were in lockdown, my wife and I filled out our census form. It took us less than 5 minutes. Maybe I went online. I went online and filled it out. But I used my cell phone, and it took me less than 5 minutes, Robin. So it's not complicated. It's easy to do. And I would just hope people in St. Louis City and County would be willing to do their part so that we get counted, so that their kids and grandkids are counted and get all of the federal resources necessary.
It's so important. Ms. Sanders.
It's so yes. So one of the things that you mentioned in terms of the complete count. So just as the Congressman mentioned, we do count prisoners, and we do that through what we call a group quarters operation, where we're also going to transitional places, like parks and things like that. So there's a complete count. Those operations will take place later in September in the fall. We're starting some of them now. But I think it's important also to note that as we think about the census and how important it is to take those 10 minutes, it will impact the next generation for the next 10 years. Our communities need the resources that are driven by census data, by census numbers. It is safe. We will not share your information. We will share the data that's collected for, number one, reapportionment, and secondly, the $675 billion that's distributed annually.
I was going to say that then. So my census response really can make a difference.
It can make a difference in your community. When you talk about lunch programs, we talk about Head Start, we talk about senior facilities, we talk about libraries, infrastructure. The data that informs those decisions are from the 2020 census. Right. How many people are a certain age are living in a community? And so it's so important.
It's so important for people to continue to look at the realities of what's going on in their communities and filling those forms out. Now, if I'm not an English-speaking person, but I am a citizen of this country, and I live in a home where you need to find out who's there, are there people that can help those non-English speaking folks fill out those forms?
So I want to speak from 2 points there. First, we have a telephone line that you can call in for assistance, and that's 844-468-2020. But in addition to that, we also have staff that we have hired that's going to go into those low responding communities. Right now, St. Louis has a 49.6% response rate. And so we're hiring people to go into those communities and go where people are. So we know that people are still shopping. There are some essential things that individuals are doing. So we provided them PPE, gloves, and they will have an iPad, and they will be able to help answer their questions, show them how to get online if they need, like the Congressman spoke about, they have the ability to do it on their smartphone. Okay. So we have staff that started on Monday going out and conducting that work. Really, really soon, by the end of this month, that is when we will deploy the most of our field staff to go door to door and knock on the doors. And all of them have been trained in terms of virtually, how do you communicate with someone during this COVID environment? And they will have PPE as well.
So they'll be ready. Go ahead, I'm sorry.
So it's very important to note that you can avoid that knock on the door and go online right now and respond to the census. Go to 2020census.gov and be counted. It's your voice and your power.
I want to thank you so much for saying that to people. And the best thing to do is to go on and fill that out online so no one will come knock at your door. But if you don't, someone will come knock at your door. Put your mask on.
Yes.
And let's get this conversation going and know how important the census is to fill out for a community at this time. I really wanted people to find out more about that. We are running out of time. This went so quickly. But I want to thank you both for coming on board today on City Corner and talking with us about the census and how important it is. Thank you so much. I really appreciate it.
Thank you.
Thank you, Robin, and please invite me back.
You will. I invite you back most definitely, Congressman Clay. Thank you.
And let's get St. Louis counted.
All right.
Voice counts now.
I agree. I'm with you as a team. Let's go.
We'll be back with more City Corner in just a moment.
Garden is loved by green thumbs and non-gardening types alike because you can play. You can relax. And there's always something new to experience, no matter the time of day or the season. And learn about conservation and one-of-a-kind plants. So come and experience St. Louis.
About St. Louis is the 79 unique neighborhoods nestled into 108 city parks, including Forest Park, which is actually larger than Central Park in New York, and of course, the beautiful Tower Grove Park where I'm at now. Oh, the St. Louis Blues. We've got the St. Louis Surge, two-time WBCBL champions. We've got Harris Stowe, WashU, St. Louis University, and of course, the 11-time World Series champion, St. Louis Cardinals. So come experience St. Louis.
Your girls have been with you through every moment of your life. They were with you when... But how well do you know them? You don't know my... Knowing your breath...
Hi, I'm Robin Boyce, and we're back with City Corner. In the studios with me right now, or in the Zoom studios right now, are two professors of psychology, or two individuals who work in the psychological field. Let's put it that way. One is Ms. Ann Steffen, who is professor at the Department of Psychology of Science at the University of Missouri, St. Louis. I thought I'd call my alum and give them a call and say, hey, I see all these folks on from all these other universities around here.
We appreciate that. We have a lot of, that's right, a lot of UMSL students and alumni and faculty and staff are all living in the city, you bet.
Yeah, we're here, okay. We stayed, okay. And also with me is Mr. C.J. Massey, who is EPA consultant with Barnes-Jewish Children's Hospital. You are part of, through the City of St. Louis, I'm a City of St. Louis worker, and we produce this show through the City of St. Louis. We have a really cool program called Be Fit, and we can call you guys anytime to get counseling or whatever it is we need. The City of St. Louis is about keeping people well, their employees. So that is correct. You, CJ. Thank you so much for coming on. I really appreciate you. Both of you, Ann, you can give it a start. What have you been seeing in patients? What are they saying about COVID and dealing with this psychologically?
Well, you know, there's this thing called stress proliferation, which means that it doesn't just start in one area. As you said, this COVID pandemic is reaching into all facets of life, right? And so it's not just, you know, many of us have had stressful life events that are in one area of work or family life or personal situation, but this more than a lot of other situations like really bleeds into everything. So people are finding themselves very stressed, and certainly, you know, anxiety, depression, folks who are using substances to cope are struggling at this point. So there's a lot going on.
Yeah, there is a lot going on. How about you, CJ? What are you seeing from patients who are calling and saying, I'm stressed out from this COVID?
Sure. The awesome thing is I get to work with a lot of healthcare professionals and helpers and first responders. So a couple things that are kind of unique, but also I think are shared, is that fear, the fear of kind of COVID itself. What if we get it? And what if we give it to other people?
Wow.
Other things could be a sadness and maybe frustration when our family members may want to distance themselves from us because we work in helping fields. You know, internally, a lot of us are high achievers. We like to perform. We want to do our best, and we may not be able to do that. So sometimes we don't feel so good about ourselves. Yeah. And I think finally, this is more from me and my observations, is we're in a state of helplessness. COVID is a situation that right now does not have a solution. And as long as we don't have a solution, our mind is going to be a little bit on edge for some time.
That is the scary part. We don't know what this virus is all about. We don't know where it's going. All we know is looking for a host. And we have to protect ourselves constantly with reference to the washing of the hands, putting masks on, staying 6 feet apart. It's just so important that people really realize that's what's going to help our situation. I mean, we're dealing with a rise at this time of the recording of this show of the rate going up in the state of Missouri. That's scary, and we don't need that at this time. So I might emphasize to people who are viewing this program that it's so important to wear your mask and practice everything that the CDC is talking about and our local health department governments here in St. Louis City. It's so important. Now, when it comes to dealing with individuals who've had COVID, have either one of you dealt with clients who have COVID?
So yes, so I can say that at UM St. Louis, UMSL, for all of us who are familiar with it, we've been starting to work with individuals who are getting discharged from either hospital or from inpatient rehab. If they were sick enough that they were in the ICU and they've had a a long enough period of time in the hospital that sometimes they need quite a bit of rehabilitation after they get home. And so we have developed a program specific for recovering from COVID for those individuals who are really struggling with being back home. And it's a long road, not for everyone, but for a number of individuals. The process of recovering involves an awful lot for them and for their families. So
what are some of the tips that you may give that COVID patient who is just, you know, afraid? They're not quite understanding what's going on. They have to go into the family home. What are some of those tips that you might give them?
Well, you know, the biggest tips for both them and their family is one of patience. And so individuals who are coming back home who may still have a lot of fatigue, shortness of breath, they may have anxiety and some trauma from their experience in the hospital. And so the patience and working slowly to know that some of the difficulties that we're seeing in patients who've had a pretty serious illness, so they have changes in their memory and their thinking. They may have increases in anxiety that's associated with that breathlessness. And so one of the things that we work with them in our clinic is ways of both managing that anxiety and stress associated with recovery and continuing to make a little progress every day at a time.
Every day at a time is what it's all about. CJ, some of the patients that you may have encountered who are dealing with the COVID with themselves or even with family members, what are some of the tips that you might talk with them about how to cope with that situation?
I would actually compliment Anne with her statement of patience. The challenge with this is not only do we have the fear of it, but if we do contract it, the recovery time is much longer than the simple flu.
Yeah.
We'll both probably be questioning our bodies because it's having a reaction that we've never had before, as well as that performance thing. We like to do things, and when we don't get to do them, it shocks us both, not just physically, but also mentally.
Is that a little bit what's going on with some people who have got to get back into the bars, have got to socialize, knowing we're dealing with something here that's a total unknown? Is that what's going on with the rush for people to just get back in? Is that what's going on? Are they not?
I wouldn't necessarily be able to statistically validate that, but I can say in general, we like normal. And since March, our normal is gone.
Yeah.
A lot of the conversations that I've been having, and I'm sure Anne has been having as well, is helping each other recognize that the way our life was is not the same. And that's okay. What we need to look at, and I find has been helpful for both me and many others, is to go, okay, how do I want my life to look like now, given what resources and situations we have? And not gonna lie, I like my routine. And when my routine gets messed up, I don't know what to do.
Absolutely.
I know, it's been rattling. It's like, it's okay. But for me, it's been the stressors of learning new technology and just really having to talk to myself and talk myself down and say, okay, you got this. You're a smart person. and talking to myself that way. But there's some people who probably are just, they're A-type personalities. They're used to doing it a certain way, but they don't want to give it up. I mean, what do you say to those kind of people, Anne?
Well, there's that, and I think that to some extent, in some parts of the media, there's some scare tactics that we know don't work. So the psychology of motivating people to do good, healthy behaviors, whether it's smoking or not driving under the influence. So in the world of public health and behavioral health, we have a lot of information about, and we know that scare tactics don't work. that, oh, this might kill you, in fact, is too far removed for most individuals. And so, you know, we find that, you know, talking to teens about smoking, we don't want to talk about lung cancer. We say, you know, you're going to kiss somebody and your breath is going to stink of cigarette smoke, and they may not like you when your breath smells.
Right.
So, you know, that analogy for COVID, I think, is something about having some consequences that are a little bit closer to home than, oh, this might kill you or this might put you in the ICU. And so,
what can the media do differently? How can we promote to people how we need to mitigate this situation? What do we need to do to talk to the constituency of this city of St. Louis?
Yeah.
What can we do to make a difference then?
Well,
actually,
you know, go ahead, CJ.
May I, Ann? Thank you.
Yeah.
Sorry, it's different being online.
Yeah.
One of the things that I find has been helpful, and maybe I'm not sure how the media could do it, but is to really start asking the question of, if we can't guarantee safety right now, what can we do to increase our safety? Because as we're focusing on that, we're actually coming up with solutions for ourselves and for each other. A lot of media consumption today is, here are the newest statistics. Here's the thing, and it's scary.
Yeah.
So we can talk about strategies a little later, but one thing that I have learned myself and other people have taught me is I have to moderate my media consumption.
Okay.
Which is kind of ironic because I'm on a media platform.
Right. But we can control that then. We can control what we're consuming from the media then, is what you're saying?
Not just what we are, but how much we are at one time.
Okay.
I believe that it's important that we stay informed. Mm-hmm. Yet there does become a threshold where too much is no longer helpful.
Too much can be no longer helpful, but we can't talk about it enough. We can't talk about how to help ourselves enough. I'm running out of time. I have got to have you both back on, because it will be a continuation of conversation, and we're going to be doing tips pretty soon on helping people to stay calm, do the Zen, because we're going to get through this thing. I want to thank you both so much for coming on City Corner and talking with our audience about how important it is to really, really understand that it's going to be okay. Would you say that?
Yes.
Absolutely. It's going to be okay. And people can call UMSL for information on the variety of resources that we have for coping with COVID. And that's 314-516-5771.
And we'll get that information out there, and they know where to find you, CJ.
Yeah, just let me touch base for everyone.